Sunday. Oh, that's good. Today, I shall be giving tutorials on male neoplasics, on male tumors. Yes, the other time I actually deliberated on female tumors. Yes, there are a lot of tumors, cancers that disturb male individuals. Yes, most of them could be life-threatening. Yes, I'm concentrating on neoplastic lesion this time around, that is on tumor or cancer lesions. Yes. Yeah, after deliberation on cancer lesions, I shall be talking about other diseases that is also having conflicts with mankind. Yes. Well, so many tumors affect male individuals. Some of them could be critochid, undistended testes. The most common afflictions, tumor afflictions, is BPH, prostate, prostatic hyperplasia, and a prostate cancer. Yes, BPH, what I mean by prostate, prostate is that type of disease, lesion, that most times catheter, tubular substance is fixed into the penis, into the penile organ of a man to allow urinations. Yes, this is the type of disease I shall be deliberating on today. Prostate is a male lesion because prostate is only found in men, it's not found in women. Just like you cannot find uterus, womb in men. You only find uterus in women. You see, prostate does basic physiological functions in the body, in the body of a man. It helps in spermatogenesis, that is production of sperm cells. But sometimes when certain hormone increase, especially androgen. Androgen is a male hormone. When there is unnecessary production of androgen, a male hormone, there's that likelihood of prostate afflictions. Yes. You see, just ordinary benign lesions, ordinary slow onset of growth of prostate tumors can result to death, sudden death. Yes. Not to even talk about frank cancer, invasive cancer. Yes. You see, the logic or the clinical cause of prostate affliction is not so very good. Once there's enlargement of prostate gland, enlargement of prostate gland somehow narrowed the urinary tract of a male individual. So what I mean the urinary tract, the tract in which urine passes. Yes, urine that is in the bladder, bladder is normally on top. And urine that is formed in the bladder normally, when exfoliated, when removed, it normally passes through the urinary tract. That is a hollow part of the penis. It is that same hollow part sperm passes. Yes. That hollow part of the penis could be occluded, could be blocked as a result of steady growth or prostate glands towards the urinary tract of a male individual. So what happened is the things that are implicated mainly is hormonal and imbalances, increased secretion of male hormone. Yes, there are certain drugs that will increase secretion of male hormone. Some of these um, exogenous androgen and again this disease could be familial, that is, it could be a hereditary based disease because individuals, family that experience prostate afflictions like prostate tumors, there's that high percentage that people in that family could also have prostate tumor during the course of their life. Yes. However, the disease prostate tumor, especially the benign prostate afflictions. What I mean by the benign prostate is ordinarily known as BPH. Yes. A lot of men are admitted in the hospital due to benign lesions. But if the cancer ensues, the cancer of the prostate, most times is normally devastating. It could lead to cell infiltrate into various parts of the body. It could be bone marrow, it could be brain cells, it could be liver, it could be kidney. Yes. As you know, the penis or the urinary system involve the kidney. The urinary system involve the kidney. So when urine is held back, there is maturation in urination. That is, individual finding it difficult to urinate. What happens is that such individual is unable to empty complete urine from his system that ought to be emptied. Yes. Now some urine are held back. Once this few amount of urine that is held back goes back to the urinary bladder, what happens is, as the individual find it difficult to urinate, even the pressure in urination as a result of enlargement of the prostate gland, narrowing the urinary tract, there's that likelihood that because of the current of urine, the pressure being matched by the individual, some many blood vessels could even be injured, and such person could be urinating blood along with urine. And again, once the situation result to that, some of this urine that the clean blood are held back. Over a long period of time, there could be inflammatory infections, so inflammatory based infections in the urine that is held back, mainly in the urinary bladder. What I mean is that as urine is not completely removed, emptied from the body system, and some quantity of urine is held back, what happens is that microorganisms, bacteria, fungi could grow within the urinary bladder. Yes, that's what I mean. That is inside the body of this person suffering prostate affliction. And some of the bacteria, because the urinary system directly linked to the kidney, some of these bacteria could invade the kidney. Yes, could invade the kidney and make kidney incompetent or it could induce kidney failure. So because the parenchyma of the kidney, which has the glomerulus, if they are invaded and there's gradual necrosis or degrading of the parenchyma, a time may ensue that kidney may find it difficult to perform its physiological functions, that is, its normal functions. As you know, kidney is responsible for ultrafiltration. What I mean by ultrafiltration, you know that urine, sweat, originally they are part of blood, but they are unwanted material from blood because the body doesn't need it. If the urine stays continuously in blood, such urine that is not filtered by kidney could cause toxic or could affect the body system, the organs of the body. Yes, because they are regarded toxic, unwanted material from blood. So the function of kidney is to clear through ultrafiltration, to remove these materials, urine and sweat, that is not needed, that is part of blood but not needed for normal functioning of the body, for physiological functioning of the body. Is not needed. So, and as such, it needs to be removed. Failure to remove it can lead to one, death of such person in a very short period. Yes, because if the urine is unable to be filtered out, first of all, what it means is that the kidney is incompetent and such person is having kidney failure. And that is why a lot of people with prostate afflictions, even BPH, I'm talking about benign prostatic hyperplasia. Yes. Such person should avoid much intake of salty food. Anything salt. It could be sodium chloride. It could be spices, all this curry, margarine, salt from Indomie, so anything sauce. And such person must reduce because you'll be taking a very low quantity of sauce. Otherwise, kidney can easily fail due to multifactorial indices. One, infections, then poor kidney functions, and all that, because infection itself, not infection gotten from female individual, infections that was incubated in the body of the man due to urine that was held back to the bladder, and sometimes blood is able carried along. So it's just like, for instance, there's a soup in a cup, in a tight, uh, closed cup, well covered. Yes. If the soup is not warm and you traveled, don't be surprised that germs, microorganisms will grow in that soup. It doesn't necessarily mean that somebody opened it and microorganisms just came. No. Even when such soup is closed, in as far is not warm, the same situation is lacking to this. A urine is held back, was not completely emptied because of maturation, because of difficulty in maturation due to enlargement of prostate gland that is narrowing the urinary tract, the tract in which urine passes. So such individual most times will develop inflammatory base lesion. So microorganisms will grow within that person, and they may grow towards the kidney because it is the same. The penile region and kidney, which is called urinary system, they are the same system, so they easily invade kidney parenchymas. Yes, you see, that is why when you are treating prostate neoplasms, prostate tumors, or cancer, you don't just direct be treating the tumor alone without also using antibiotics, because there's high tendency that such person has infections within his urinary system. Yes. So that when you are treating prostate tumor, the use of neoplastic drug, the use of tumor drugs, we most times slow down the growth of such prostate glands. Yes, that is chemotherapy. However, if you fail to also treat with antibiotics, so a good physician should know that there is that likelihood of inflammatory or bacterial or microorganism incubation within the system. So the use of certain drug, antibiotics, antiflagellates, and other necessary drugs that must be tailored in the treatments of such disease. Yes, however, prostate tumors or prostate BPH, the benign prostate hyperplasia, that is the slow growth of prostate that is mostly common when not well addressed, managed, or treated. It could lead to carcinoma of the prostate. It could lead to prostate cancer. It could lead to invasive cancer and become malignant. Yes, and when it becomes malignant, the malignant cells, some of them leave the primary area, the prostate gland, infiltrate other distal cells in the body. Yes, what I mean, distal cells, brain cells, liver cells, bone marrow, and all that, start destroying the cells along those tissues. As you know, blood production in adults, one of the organs is bone marrow. So anything that infiltrates bone marrow, you should know that there's that likelihood of what? Of hemodilution, of hemolysis. Yes, these are the clinical cause. What I mean by hemolysis, destruction of blood. And some person, sometimes and most times, will be having low percentage of blood. Some person could be transfused severally. Yes, especially people that have now developed frank cancer. So it is not a good thing, and nobody wishes to have such a disease, because there are some diseases that once they come, you just have to manage it. Yes, but however, when you tailor certain food that contain estrogen, like I said, benign tumors, I mean prostate tumors, disease of male individuals, especially this prostate, is due to high level secretion of androgen. Yes, which affects or stimulates the enlargement of prostate glands. So what we now do, any food that contains estrogen is female hormone, while androgen is male hormone. And the problem here is androgen, because of high level of androgen in the system, result to benign or cancer of the prostate. So when you now introduce estrogen, there are some plants that contain high level of estrogen, like soya beans or soya milk contain phytoestrogen. Yes, individuals that takes soya milk or soya beans, yes, we hardly go down with prostate affliction. Even tomatoes, there's a substance in tomatoes called lycopene. Yes, if you consume raw tomatoes all the time, especially if prostate runs in that family, individuals should capitalize on consumption of raw tomatoes and soya milk. Soya milk is good in the sense that it supplies estrogen that will slow down the growth of such tumor, and also it will enhance blood production. As you know, that milk enhances blood production, and most people with prostate tumors always develop low level of blood. Yes, these two food items are very, very good in the management and treatment of prostate afflictions. Another major or basic food is this pumpkin seed. Yes, pumpkin seed is one of the major potent food therapy that one can tailor in the management of prostate afflictions. Yes, because my content is mainly on food therapy, not drug therapy. Yes, but there are ways when you want to use synthetic analogs. Chemotherapy, there are drugs that can be tailored in the management of prostate afflictions. Then surgical resection through surgery and radiotherapy. They are expensive measure. However, it's just uh, it's just management. Yes, it's management. It's not that it's curable. You try to take to medical advice, medical prescription, and all that to slow down the growth. And that is why administration of certain food over a long period of time do normally slow down the growth of these tumor afflictions. However, one must make sure that it prevents cancer genesis, because the most common prostate lesions is benign prostatic hyperplasia, known as BPH. Yes, when that is well managed, such individual may not develop prostate cancer. Yes, because some few individuals do develop carcinoma of the prostate, that's prostate cancer and all that, which is most times invasive. You see, food is, and food in this regard is very helpful, especially on prostate afflictions. Even established BPH can be redirected, can be addressed with food therapy I just mentioned. Tomatoes is a very potent recipe. Soya milk or soya beans, a very potent recipes. Yes, but such individual should make sure that he avoids anything that may promote cell growth, like folates. Yes, I'm talking about folic acid. Folic acid is part of DNA, part of nucleic acid, and it may function its production of cell. So such individuals should avoid such drugs. Any person having tumor genesis must avoid such drugs. The tumor itself or cancer itself is overproduction of certain cell type in the body. Thank you for listening.